The surgery can either be removal of the lump, sometimes called a lumpectomy, if there is a lump, or a segmental mastectomy, or a partial mastectomy. The language can be quite confusing, but it involves removing part of the breast. Or an alternative is to remove the whole of the breast, a mastectomy. If a mastectomy is performed, then a form of breast reconstruction can be offered to try and rebuild the breast either at the same time or at a later date. When DCIS is removed with a lumpectomy, conserving the rest of the breast, the aim is to get clear or clean margins around the DCIS, and that is judged by the pathologist and often is not available immediately at the time of surgery. The importance of getting clear or clean margins is to try and reduce the chances of any DCIS returning in that part of the breast. Radiation therapy or radiotherapy is offered to women who have had DCIS removed, where the DCIS has been in part of the breast and most of the breast has been left behind. Breast conservation, some people would term it. That radiation therapy effectively reduces the chance of any DCIS coming back in that same breast.
So from what I've read, it seems that a lot of women diagnosed with DCIS have to have radiation. Can you tell me a little bit more about that?
Radiation is actually a very important part of standard treatment for DCIS, but not all women who have DCIS require radiation. The most common situation in which we would recommend it is if a woman has a lumpectomy and there are certain features of the DCIS that appear to make it at higher risk for coming back if we don't do some other additional treatment in addition to the lumpectomy itself. So in the United States, about 2/3 of women who undergo lumpectomy actually also have radiation. Now the choice of whether you do it, whether you fulfill the criteria for when we would recommend you do it, these are questions that you really should discuss with a radiation oncologist. But I think it's important for you to know that not all women need to have radiation after a lumpectomy. Also, when you're making the decision of whether to do radiation or not, I think it's very important to keep in mind that you really can only have radiation once. So if you have a lumpectomy, you have radiation, and the DCIS comes back, you're not going to be a candidate for radiation again. So a lot of times women who recur after a lumpectomy and radiation are recommended to have a mastectomy. If women have a mastectomy from the very beginning for DCIS, then it's very uncommon that we'll recommend radiation in addition to the surgery.
Endocrine therapy involves taking a tablet, usually for a period of 5 years or more, and those tablets act to interfere with the way that hormones act on the breast, and therefore to reduce the potential stimulation of the breast tissue, and therefore reduce the chances of developing further DCIS or DCIS developing into invasive breast cancer. The side effects of endocrine therapy include a number of effects which can affect some but not all women. Quite typically, hot flashes or hot flushes are the sort of thing that affect 2/3 or 3/4 of women when they first start their endocrine therapy. Other significant effects, depending on the sort of endocrine therapy, can be vaginal or vaginal dryness, can include the joints, particularly the joints of the hand and the joints of your feet and ankles, aching as a consequence of taking the therapy. The other side effects that some women notice, perhaps longer lasting side effects, are bone thinning with some of the anti-hormonal agents. So the side effects of surgery, radiation therapy and endocrine therapy potentially can affect any woman who's being treated. The side effects of surgery are potential for bruising or bleeding, rarely infection, and occasionally pain which can last for some time afterwards. There can also be loss of sensation or altered sensation to the breast. The side effects of radiation therapy are often to have a sunburn type effect during the course of radiation therapy, and then at a later date the irradiated radiation treated breast can seem a little bit more uncomfortable and sometimes a little bit more fibrotic or tense than a normal breast. The side effects of endocrine therapy are perhaps the effects which are most long-lasting for many women.
When I found out that I was ER positive, I knew that I was eligible to take endocrine therapy. So what I did is go with all the information that I gathered by reading and went to my doctor so she and I myself could make an informed decision of which was the best therapy that I could take. The decision, of course, was based on the side effects and my concerns about them, and one of those was the possibility of having joint pain. And surely enough, I got joint pain in my shoulders. So then the discussion became what to do. The options were, if it continued, to switch therapies or to discontinue. I was lucky enough that the pain subsided, and then I was able to continue with the endocrine therapy. One of the concerns about taking endocrine therapy was the effect of the therapy will have on my bones. So my doctor and I decided that I should have a bone density in order to check the bone health. Unfortunately, the bones were not as strong as I hoped to, and now we are in discussion of what to do. In the meantime, what I'm doing is weight-bearing exercises that are known to strengthen the bones. At the same time, what they do is improve my overall health. In the future, there's the possibility that I have to take some drug, and then we will have to have the discussion again about the pros and the cons in order to make the best decision for myself.
The aims of radiotherapy and of endocrine therapy are to reduce the chances of DCIS returning or of future invasive breast cancer. However, neither radiation therapy nor, in most studies, endocrine therapy reduces the lifetime risk of dying from breast cancer.